Welcome to this week's edition of AI in Healthcare Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. A review of 25 Voice as Vital Signs startups reveals bold claims on accuracy and empowerment, but little on underlying voice datasets. With no standards or investor push, transparency remains optional, risking bias and eroding public trust. Authors call for open data, model cards, and ethical marketing to keep voice AI accountable. Adding human coaching to a smoking cessation chatbot boosted user engagement. Yet some users did better without a coach. Reinforcement learning showed that benefit-optimized models favored already engaged users. Fairness, autonomy, or sickest-first strategies helped rebalance support. Open source code is provided for building fairer e-health tools. Reanalysis of 15 Crohn's trials, covering 5,703 patients, found 7 virtual responder groups across anti-TNF, interleukin-12/23, and integrin therapies. Women over 50 responded well to interleukin-12/23, but made up just 2% of trial participants, despite being 25% of real-world ulcerative colitis patients. These insights support Crohn'sRx.org, which turns trial data into personalized care tools. The FDA's adverse event system tracks about 950 cleared AI tools, but logged only 943 incidents from 2010 to 2023. Current codes miss risks like concept drift or misuse. Authors recommend quarterly real-world reports, AI-specific model cards, and traceable data. They propose treating AI tools as living systems needing ongoing oversight. A 6-factor model predicts frailty with an AUC of 0.84. TUG time, education, nutrition, balance confidence, function, and ADL status were key. Applied to older Koreans, the tool helps detect reversible frailty for early, personalized care. Clinically launched Clara, an AI that analyzes selfies for skin texture, hydration, and tone, recommending brand-neutral skincare routines. Users can track progress or connect with dermatologists. Privacy is built in by design. Trillium Clinic's 24/7 dermatology chatbot handles questions, triage, and scheduling. Personalized responses ease clinical loads and improve access. NTU Singapore's tariff program maps lung, gut, and cancer traits in Asian populations. Paired with localized AI and lung function metrics, the goal is to cut misdiagnoses and improve precision care. Imperial College's Mesh Heart model generates 3D cardiac digital twins from MRI data, visualizing subtle heart motion issues. These may one day simulate treatment effects before symptoms appear. CardioSense launched Seismic HF2, comparing non-invasive pressure estimates to catheter data. Aiming to catch early heart failure in 6.7 million U.S. patients, the study supports regulatory approval. Huino's ECG GraphNet uses graph-based AI to classify arrhythmias on variable length ECGs with high accuracy. Integrated with Memo Q patches, it enables long-term monitoring reimbursed in Korea. Walmart's Everyday Health Signals applies AI to shopping data, recommending healthy, benefit-eligible foods to Medicare Advantage customers. In-app scanning promotes nutrition and engagement. Ombic and CardioMediv launched Medive, a wearable monitor combining ECG, blood pressure, oxygen, spirometry, and thermal data. Powered by a low-energy chip, it provides real-time alerts. Mediv won Medical Innovation of the Year ahead of a 2026 EU launch. At ASCO, ONC-AI shared radiomic biomarkers that outperform RECIST in predicting survival for non-small cell lung cancer. Deep learning flagged treatment failure months earlier. Validated with Pfizer and Baylor, the system is FDA-ready. In Sichuan, China's TRIL-DCT lung cancer screening raised stage IA1 detection from 16% to 28%. Combining CT, AI triage, and ctDNA testing, 5-year survival now tops 90% for stage 1 and 97% for ultra-early cases. Guy's and St. Thomas's NHS Trust is piloting an AI-based women's health platform for 1,000 staff. Launched with Anira Health, it includes genome data, biomarkers, and real-time support for conditions like PCOS and cholesterol, boosting workforce well-being. Stay ahead in AI and digital health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.